Okay, this will be my last time explaining this. Look. Nothing in my mouth. My gums bleed. I just have really sensitive gums. This is not good though.
That's not normal. Well, it is normal sometimes. I mean, I see a ton of people with bleeding gums, but why is hers different? Well, you see, normally when someone has bleeding gums, it's because they have gingivitis. They're not brushing, they're not flossing, plaque and gunk get up in there and start to irritate the gum tissue. Then whenever you go to brush or floss, it starts to bleed in that area because you're actually aggravating and removing all the nastiness that's in your teeth. Now, normally from there, we would tell you just to keep brushing and then eventually your gums would tighten up, the inflammation would go away, and voila, your gums will stop bleeding. But in this case, this is not normal. A couple things could be happening here. One, she could be using one of those blood capsule pills and she could just have it up here in the roof of her mouth and she was lying to all of us just for views. Two, if that's not the case, that's not good. It could be a bunch of different things. It could be she's very anemic. It could be she has hemophilia, which means that you bleed really easy if you're cut or scratched. And probably the worst one of all is it could be something like leukemia. Now, she said she went to a dentist and got it checked out and they said she was in the clear on there. So hopefully they're sending her to the right people to have a look at. But trust me, if you're bleeding this much just by sucking on your gums a little bit, you need to go to a medical doctor and go get some help.